A dental implant is a small titanium rod that we place into the patient's mouth to replace a tooth that's missing or needs to be removed. It's the only way we can replace a tooth without potential damage to an adjacent tooth or teeth in the patient's mouth. It is the most natural feeling prosthesis that we can use. It doesn't need to be removed and it's fixed in all the time and gives you the best ability to chew and speak and smile without worrying about any problems. It differs from a bridge. A bridge is basically where we take the teeth, one tooth or two teeth on either side of the space, and we file them down slightly to basically put crowns on that then have a tooth joined to them. So the potential risk of that is that it's damaging the teeth on either side, so you can end up with problems like needing root canal treatment or potentially quickening their loss in future. A denture is another option to fill space, but it's a removable option, so it's something you take in and out. It can move around a bit, it can also damage your gums because it rests on them, and potentially other teeth on either side. So it's not ideal compared to an implant, which doesn't harm any other teeth and gives you the best replacement. The amount of time it takes for an implant kind of process from start to finish depends on the scenario, again, which is dependent on how the patient attends in the beginning. If a patient has a tooth and needs that tooth taken out, sometimes we can remove the tooth and place the implant at the same time. Other times we have to take the tooth out, let maybe the bone heal and then infection clear, and then place the implant maybe 2 to 3 months after that. All implants need around about 8 weeks minimum to heal and fuse to the bone. So that has to be taken into account during the process, and then we check the implant before we start getting the little crown made to go on top of the implant. So it can differ depending on the scenario. Normally it's around about 4 months minimum, and can be anywhere up to 6 or 8 months. So on average around about 6 months from start to finish. But again, we'll outlay that when we assess your mouth and your scenario when you come to see us. A lot of people ask us if they're a good candidate for implants. It's difficult to know exactly, as everyone's scenario is different. The best thing to do is to come in, get an assessment done where we will check around your mouth, check the health of your mouth in general and your other teeth and your gums. We'll also take scans and x-rays and determine if we've got enough adequate bone and enough space to place an implant, or implants depending on how many teeth you're missing. The major problem we have is when people maybe lose a tooth a long time ago, as the bone shrinks over time. So we may need to do a little bit of bone augmentation, which is a fancy word for bone grafting, and it basically means that we can rebuild the bone potentially beforehand or during the procedure when we place an implant. So it's difficult to determine exactly who's perfect for implants. Most people will be able to do something to get an implant in there, but we may need to put a wee bit of foundation work in before we can actually get the implant in. But again, best thing to do is come in, get a wee assessment done, and we can find out what the best course of action is for you. So a common question you get asked is how long do implants last? Now again, this can vary from person to person, depending on their medical history, if they're a smoker, or if they have any other problems. The main issue with implants is they can get gum disease around them, which can lead to bone loss. So we need to make sure that maintenance is really, really optimum and you're coming in to get them checked and looked after all the time. But what we normally tell patients on average is that implants should last around about 15 to 20 years as long as they're looked after properly. You don't smoke and you don't do anything that's going to cause any damage to the implant or the bone around it. So again, if you're a smoker or you're maybe diabetic or another kind of complex medical history, you may get some less than that, but on the law of averages we tend to say around about 15 to 20 years as long as it's looked after and maintained properly. So a lot of people ask us what our success rates are for dental implants. It's really, really high for any dental procedure. It's around a 1 to 2% failure rate, so our success rate is about 98 to 99%, so it's really high. It can be slightly lower if you're a smoker or if you have a complex medical history, but again, we'll outline that when you're in for your assessment. With any surgical procedure, there are always risks and complications. We try and outline these to you. None of them are very serious or severe. The main one is obviously the implant may not attach to your bone the way we want it to and may need to be removed. Normally we give it a couple of months to allow the healing to happen, and then we check the implant, and if it hasn't taken, then we'll talk to you about getting that replaced under your guarantee. Other things like a little bit of swelling, bruising, Some discomfort afterwards are common due to us having to do a little bit of surgery, but these are normally pretty minimal and controlled with kind of routine pain relief and pain medications. So complications are really low, and we ensure that we are doing everything possible to minimise any complications for you during and after the procedure. We advise that you see a dental therapist regularly after having implants done, ideally every 3 months, to make sure that the gum and the implant itself are nice and healthy. We like to take an x-ray of the implants once a year, minimal, just to ensure that the bone levels are staying consistent from when we've placed the implants. At home, it's a case of doing a little bit extra than you would do over kind of natural teeth, because they don't have the same kind of defense mechanisms that teeth have. So using little TP brushes and floss, and some other kind of special floss as well for larger bridges and things. Also, water picks are a good additional method to use as well as the normal toothbrushing and the little TPs and floss. But the main thing is just keeping maintenance up with your dental therapist and making sure that they're checked by a dentist who's adequately qualified once a year, to ensure any little problems can be dealt with swiftly before they turn into bigger problems. Dental implants are the single best method for replacing a tooth. Due to modern technology, we have loads of tricks nowadays that we can use to try and match seamlessly to your natural teeth that are next to the implant or implants. There's some slight limitations depending on how long you've lost a tooth for, if you've lost any gum or bone shrinkage and things over the years. But again, these will be outlaid to you at your assessment if there's any problems or compromises or anything like that we may think that may happen. So, but we will always strive to achieve the optimal aesthetics for you from the outset. If it's found that you don't maybe have quite enough bone for an implant, that's not the end of the world. We can normally do some procedures that will rebuild some or all of that bone that you've lost over time. Sometimes these need to be done prior to the implant being placed, and sometimes it can be done during the implant placement. Obviously that will cause a little bit of issue with the timeline. If you're having to get a two-stage approach where we have to do implant at a separate time from doing bone grafting, so the bone grafting will be done first, that may add on a few months onto your treatment plan before we can put the implant in. If we have to do anything like what's called a sinus lift, where you've maybe not got quite enough bone in the top jaw, then again that can add on maybe up 6 or 9 months depending on how much bone that we need to rebuild. So again, it may add a little bit of time on, but again we'll outlay that to you when you're in for your assessment, so you're fully aware of the sort of time from start to finish for your treatment plan. So during the procedure for implant, you are given local anaesthetic, like any other dental procedure. You'll feel a little bit of pressure, a little bit of vibration, and a bit of kind of pushing and things like that while we're working. But it will not be uncomfortable during the procedure. Obviously, we have our pain-free guarantee to ensure that you're nice and comfortable during it. The main thing to think about is potentially afterwards. Some people would like to take some time off work. We don't advise that you need to take time off work or you need a few days of recovery. Most people, it's just like going to get any other regular dentistry done, where you might be a wee bit tender for a day or two awareness we've had something done. And bigger procedures, sometimes obviously depending on the person, you may get a little bit of swelling or bruising, which we would normally advise you if we think that's going to happen. That's not normally to do with the implant, but more if we're having to do any bone augmentation or grafting procedures, where you get a little bit more of an inflammatory reaction for your body. So again, we'll try and advise you if we think it would be a good idea to take some time off, but it's not hard and fast rule. As long as you feel comfortable coming in, getting it done, we maybe advise don't do it right before a wedding or a big party, because ideally you're not to drink alcohol for a couple of days afterwards, and obviously you might be a wee bit tender.